Hello, everybody, and welcome to week 4. We're covering chapter 3, cardiorespiratory endurance. So, after this chapter, you should be able to understand how the body produces energy for daily life and exercise, list major effects and benefits of cardiorespiratory endurance exercises, and explain how cardiorespiratory endurance is measured and also assessed. So, first, let's start with the basics of physiology of cardiorespiratory system. So it's just a system that circulates blood throughout your whole body, and it has the heart, the blood vessels, and respiratory system that we will go into further detail. This is just a visual depiction of the cardiorespiratory system. As you can see, we have arteries and veins all over the body. This is a close look into the heart, which we will discuss in further detail. As you can see, pulmonary circulation and systemic circulation, we will explain what it does and how it does. Pulmonary circulation is where the blood goes between the heart and the lungs and is controlled by the right side of the heart. And systemic circulation is part of the where blood travels from the heart to the rest of the body. So let's move on to blood vessels. So we have 3 different ones. We have veins, which carry the blood to the heart, arteries that carry blood away from the heart, and capillaries are just very small blood vessels that distribute the blood all over your body. The blood vessels are lined with endothelial cells that secrete nitric oxide, which promotes blood flow. We also have coronary arteries, and it's a pair of large blood vessels that branch off of the aorta, which we'll go into more detail, and they supply the heart muscle with oxygenated blood. Just a visual, an artery, as you can see, has a thick outer wall. They have a thick layer of muscles over here to control blood pressure and small lumen in comparison to a vein that has a larger lumen, but the rest of the structure is small. And in comparison to a capillary, which has a very tiny lumen and the walls are just single layered cells. In the heart, we have 2 vena cavas, which will go into further, and atriums, 2 of them, and then 2 ventricles. It's easier for me to show you a picture and describe them. As you can see, we have superior vena cava, which is on top, and inferior vena cava, which is on the bottom. And two atriums, so right atrium, left atrium, right ventricle, and left ventricle. So the blood comes from superior or inferior vena cava to the right atrium. This valve opens, goes into the right ventricle, and then goes out through the pulmonary artery into the lungs. And over here, it comes in from the pulmonary vein into the left atrium, goes the mitral or the bicuspid valve opens and goes into the left ventricle, and then it goes up to the aorta to the rest of your body. As you can see, those are the coronary arteries that we talked about before. So the lungs, blood picks up oxygen and discards the carbon dioxide. I'm sure you are aware of what carbon dioxide is, but it's just a gas that produced during metabolism. And diffusion is very important for exercise. It's the process where oxygen moves from the lungs to blood, and carbon dioxide moves from the blood to the lungs. So this is where the gases exchange. So now we have the cleaned, oxygenated blood flows from the lungs through the pulmonary veins, as I have described earlier. and into the left atrium. Left atrium fills, it pumps blood into the left ventricle. And when the left ventricle is full and pumps blood through the aorta, the body's largest artery, for distribution to the rest of the body. This is just a depiction of the aorta. I just wanted to show you guys that it's actually very massive. As you can see, it goes through. There's different levels of the aorta, but we won't be discussing those. So the heart has 4 valves that prevent blood backflow, which means in case we were over here, we don't want any of the blood to come this way back because it would create a lot of issues. So the body has these valves to prevent anything going in opposite direction that it should. When you go to the doctors and your doctor's listening to your heart, they're looking for systole and diastole. So systole is just the contraction of the heart, and diastole is the relaxation of the heart. Blood pressure, as I told you on there. Arteries, where the muscles contract and relax, that creates the blood pressure. So how fast the blood of the walls, blood vessels, how fast are they pumping? So if you ever listen to the heart, you would hear the first sound kind of like a lub and then a dub. And so we have atrial systole, as you can see, the tricuspid and the mitral, the bicuspid open. And then we go into ventricle systole where they close. And then once they close, all of the blood have a ventricle diastole. So all of these are closed, the pulmonary and the aorta, and that's when you hear the dub. So it's lub, dub, and it happens pretty quick if you ever listen to the heart. At rest, your heart beats at a rate of about 50 to 90 beats per minute, and you take about 12 to 20 breaths per minute. And typical resting blood pressure is 120 systolic and 80 diastolic. So now let's go into the respiratory system. So this is the lungs, air passages, breathing muscles supplies oxygen to the body. It removes carbon dioxide. As I told you before, the reason why carbon dioxide is very important is because alveoli, these are tiny air sacs in the lungs that allow the oxygen to exchange for carbon dioxide, and then they pull out the carbon dioxide and move it out of through the system out of the body. So if you don't have enough carbon dioxide, you won't receive new oxygen because your body doesn't think that it needs any more oxygen. It's easier to see. As you can see, these are the alveoli. It's a terrible picture, but you still get the point. So these are little alveoli. They will bring the oxygen and they will gather over here, and then they will exchange it with the blood that is in the cells. So they have to have enough carbon dioxide pressure to push out and exchange the gases. So the oxygen moves into the cells and the carbon dioxide moves back to the alveoli, which later expelled the carbon dioxide. So during exercise, I'm sure you're aware, your heart rate increases, your breathing speeds up and becomes deeper, so the diffusion can happen. The heart stroke volume, which is the amount of blood the heart pumps with each beat, and it should increase if you're pushing yourself. Cardiac output is the volume of blood pumped per minute, and it also should increase. Your working muscles receive more blood, and systolic blood pressure increases while diastolic pressure remains steady or decreases, but not very much. And oxygen to oxygenate the increased blood flow, you take deeper breaths and breathe faster in order for you to gain more energy. Which, let's talk about energy production. So you have metabolism. This is the chemical process which is necessary for you to gain energy. Energy is required to fuel vital body functions. Metabolic rate is just a rate which the body uses energy. There's three different classes of energy containing nutrients and foods. I'm sure you're aware of carbohydrates, fats, and proteins. Let's talk about glucose and glycogen. So glucose is just a simple sugar circulating in the blood, and it fuels the ATP or adenosine triphosphate production. And glycogen is a complex carbohydrate which is stored in the liver and also skeletal muscles, and it's a major fuel source during the forms of intense exercise. So glycogen is the storage form of glucose. So ATP is just a basic form of energy used by cells. It can be almost like a energy currency of the cell. Cells store a small amount of ATPs, and when they need more, they just create more energy by utilizing glucose, glycogen, and fat. We have three energy systems. So explosive immediate energy. This is the system that supplies very short bursts of energy to the muscles through the breakdown of ATP and also CP, which is creatinine phosphate. And cells can use CP to make ATP. And then the second one is anaerobic energy or non-oxidative energy. So this is where there's no oxygen. So the system that supplies energy to the muscle cells, highly intense exercise, only for a short duration by breaking down the muscles' stores of glucose and glycogen. So when we're talking about anaerobic, as I've told you before, it's absence of oxygen. We also secrete lactate acid, which is a metabolic acid resulting from metabolism of glucose and glycogen. And as soon as it's produced, lactic acid breaks down into the lactate, which is an important fuel. And training improves with the ability to use lactate as a fuel. The third one is aerobic. So this is where your system can last for long periods of time. Aerobic just depends on oxygen. I'm sure from your high school biology, you remember mitochondria, the powerhouse, and this is where ATP are produced. So they are using the carbohydrates, glucose, and glycogen, or the fats. In order for us to understand how much oxygen your body is working with at the maximum amount effort, we use VO2 max, which you will calculate after your fitness assessment. But most of the time, people just call it a VO2 max, so that maximal oxygen consumption. And this is just how much oxygen can your body use while you're pushing your hardest during an exercise. And it's measured in milliliters of oxygen per kilogram of body weight. So your body actually uses all three systems. It just depends on how fit you are or how sedentary you are and how much, which one is the major one that you utilize, because you can utilize all of them and all of them could be your major source. So let's just talk about the characteristics of body's energy system. So we have the immediate energy, the anaerobic or non-oxidative energy system, and oxidative aerobic. So during activity for which system predominates, as you can see, you can go, the immediate is just for 10 seconds. The one in aerobic is 10 seconds to 2 minutes. And oxidative, the one with oxygen, is longer than 2 minutes. The intensity is very high, so this is you're doing a sprint. Non-oxidative also is very high, and then oxidative is low to moderately high. Rate of ATP production, this is the thing that gives us energy. Immediate, very, very rapid, rapid for anaerobic, and slower but prolonged for oxidative. So that's the major difference, is because the anaerobic needs it now, and they can't use oxygen in order to help the longevity of your exercise. So it's very rapid, and this one you want it to be actually very slow so you can go for longer periods of time. So when you're a marathoner, you really want to make sure you develop slower ATP production, but a very long in comparison. If you're a sprinter, you just want it there and now. So for the fuel for the immediate, you need ATP and CP, and for the anaerobic without oxygen, you need the glycogen and glucose in order to get the energy. And for the oxygenated one, you need stores of glycogen, glucose, and fat and protein. So you need many of those stores in order to maintain this system. And so just oxygen is not used over here and over here, but it is used for the oxidative one. And simple activities for the immediate is weightlifting, picking up a bag of groceries. For anaerobic is a sprint, and for this one is a walk or an activity that lasts longer than 30 minutes. So cardiorespiratory endurance exercise really help improve your body, make it be able to cope with any stress that is currently in your environment, and also lowers risk for chronic diseases. So there's immediate effects and long-term effects of cardiorespiratory endurance exercise. For immediate, you increase pulmonary ventilation, so you get more air into the lungs. For long-term, increased sweat rate, early onset of sweating, helping to cool the body so you can go for longer times. There's also improvement in functioning, so you're able to keep increasing the heart's blood and oxygen supply, improve heart muscles and for blood pressure, strengthen the heart's contractions, increase heart cavity size, increase blood volume, reduce blood pressure, reduce blood cholesterol, and then also protect against cardiac arrest, which is a malfunction of which heart suddenly stops beating. So in order for you to train the body's metabolism, you need increased number of capillaries in the muscles, train muscles to make the most of the oxygen and fuel. So you want to make it as efficient as possible. So you want to be in the aerobic system, increase size and number of mitochondria. So remember, mitochondria is responsible for producing ATP, which is the energy, preventing glycogen depletion. So you can keep on using the glycogen for aerobic and anaerobic systems, increase the activity of cell pumps, so the structures in the cell walls for sodium, potassium, and calcium. Regular exercise can help protect cells from damage and just caused by free radicals. So how it helps chronic diseases. Regular exercise lowers your risk of CVD. It also lower risk of cancer, type 2 diabetes, and osteoporosis. Osteoporosis is where you lose bone density. Happens more in women as they age than men. Exercise increases acute inflammation during and shortly after workout, but reduces chronic levels if the training is not severe. So inflammation can occur, the body's response to tissues and cell damage, environmental poisons, or poor metabolic health. Physically fit people have a reduced risk of dying and premature from all causes. We will go into the chart. As you can see, in 1992, they did a study, and everybody and that year was alive and well. And so first let's follow the vigor. So this is very people who exercise at a high intensity. As the years go by, they die about, let's say, maybe 84 years in 2008. And then moderate or mild, there are below 80, 78 maybe. And then people who completely did no exercises, they died around 63, I would say, in 2008. As you can see, exercise, it's not just for you to have abs, but also is very important for your mental health and also aging and surviving. So other benefits is just you have better control of your body fat and then also immune systems. Exercise can either positively or negatively affect immune system. So if you're avid exercisers, your immune system is most likely ready to fight off whatever illnesses are in the air in comparison to somebody who is sedentary, who doesn't exercise. They might have a lower immune system to fight anything that is in the environment. And also, as I said previously, it helps your mental health, helps with self-image, and also sports help people to socialize, which creates immunity, which is also important for your mental health. Endurance exercises lessen anxiety, depression, stress, anger, and hostility. And regular exercise also improves sleep. So different ways we can assess cardiorespiratory fitness is the 1 mile walk test, which you could choose for your virtual fitness assessment. This is just measuring the amount of time it takes you to complete 1 mile of brisk walking. And you see fast time or low heart rate indicated high cardiorespiratory endurance. There is also a 3-minute step test. This measures your pulse and how normal after 3 minutes of stepping exercise, how is your pulse? There is a 1.5 mile run walk test. This indicates high VO2 max, which has its own chart that you will have to provide for your assignment. There's also a beep test, which predicts the VO2 max. And pre-recorded series of beeps sound off at faster and faster intervals, and the exerciser must keep up with the beeps until you can no longer do it. So in order to really understand how cardiorespiratory fit you are, you need to measure your heart rate. You can use it by a heart rate monitor or really counting your pulse. So let's see how you could do it. You could do it from your neck, which is carotid artery, or you can do your radial, so your pulse. You have a watch on the side and you count how many you and how many little beats do you hear per minute. But cardiorespiratory fitness field tests are not as accurate as something you would do in the lab. They always have to understand that there's 10 to 15% margin of error. But if you go into a laboratory and do a VO2 max test, it is as accurate as it could be because it measures your lactate, your carbon dioxide, your oxygen. So from last class, we did the FIT, VP principle, and this is something that you could add to your FIT VP principle is target heart rate zones. So the range of heart rates that should be reached and maintained during cardiorespiratory exercise to really obtain optimum training. Heart rate reserve, so the difference between maximum heart rate and resting heart rate, used in some methods of determining target heart rate zones, and MET, which is just a measure of that represents body's resting metabolic rate. So how much energy does your body require at rest? RPE is a rating of perceived exertion. This is to monitor how you feel you're doing at the moment. There's a scale, and it's another easy method is the talk test. So are you able to communicate during your exercise or not? If you are not able to, you're doing light intensity. If you aren't you're doing, if you're not able to talk during an exercise, you're doing a vigorous exercise. If you are able to, you're doing a light to moderate exercise, like we talked last week. So first, let's target heart rate zones, which are probably you have seen at every gym. This gives you by age, target heart rate zone, and 15-second counts of beats. So this is where you should check. So if you are between 20 to 24 years old, your target heart rate should be between 127 to 180. And target heart rate is where you're burning off the most possible. And then 15-second count is 32 to 45. And as you can see, when you age 65 and plus, your target heart rate zone decreases and your beats also decrease. So some exercises for MET. At rest, you are at 1 MET and you're burning 1.2 calories per minute. For example, if you're doing skiing downhill, you're using 5 to 8 METs, depending per person, and then 6 to 10 calories per minute. If you're jogging, you're using 8 to 12 METs, which is 10 to 15 calories per minute. So this is the RPE measure you can do. You can select 0 to 10. So 0, you're doing nothing at all. You're just sitting, relaxing. And then 10, you are not able to do anything more, which is impossible. So that's when you should stop your exercise. Estimating exercise intensity. So for target heart rate, you should be 55 to 69% at moderate intensity to vigorous 70 to 90% at your target heart rate. As you remember, there's the chart that tells you where you are, and then you can calculate the percent out of it. Target heart rate reserve, so you need to be at 40 to 59 for moderate, and vigorous 60 to 85. For moderate intensity exercise, you need 3 to 7 METs, or vigorous 8 to 12 METs. RP should be 4 to 5 for moderate and 5 to 8 for vigorous. And of course, talk for moderate, you should have some difficulty, but still able to. And vigorous, you're not able to do any phrases. You can just say okay, not okay. So this is just a visual representation of the FIT-BP principle for our cardiorespiratory endurance program. Exercise safety is very important. Hot water or heat stress, which is not as big of an issue here as in comparison to Florida or Texas or Arizona, something like that, you need to make sure to take in these. Dehydration could occur to anybody, so you have to hydrate the day before and make sure that you have enough fluids in your body. Heat cramps, so this is sudden muscle spasms, pain, and associated with intense exercise and hot water. Heat exhaustion results in illness. Heat stroke, severe and often fatal heat illness characterized by significantly elevated core body temperature, so you're not able to just cool off. Another is urine chart to assess the hydration. So if you're at 1, you're well hydrated, and if you're at 8, you need to hydrate immediately because you don't have enough hydration and you're most likely dehydrated. Cold weather, so you can get hypothermia, low body temperature due to exposure to cold conditions, frostbite, freezing of the body tissues, and wind chill, measure of how cold it feels based on the rate of heat loss and exposure of skin caused by the cold and wind, which is probably is an issue in Michigan. Poor air quality, for example, how it is in California and Oregon currently. Poor air quality can definitely make it unsafe for you to exercise outdoors. So if you incur any injuries, you should definitely consult your physician. If you have head or eye injuries, possible ligament injuries, broken bones, internal injuries like chest pain, fainting, increased body temperature, intolerance to hot weather. For minor stuff such as cuts and scrapes, you should use the RICE principle: rest, ice, compression, and elevation. Just common exercise injuries and symptoms. So a blister, I'm sure it's just everybody has gotten one as they grew up. Just a little sack of fluid in one spot underneath the skin. Bruise, you have pain, swelling, and also discoloration. To muscle strain, which is pain, tenderness, swelling, and loss of strength in the affected part of the body. Shin splints, so pain, tenderness in the front of the lower leg, sometimes pain in the calf muscle. You just need to rest and ice it and stretch it, make sure that nothing is wrong with it, and just purchase good quality footwear. So test your knowledge.